It is EMS week and time to honor the frontline workers who keep us safe in an emergency. I'm joined by Kevin Ferrati. He is the System Director for Emergency Management Services at Hartford HealthCare. Thank you for being with us, Kevin.
Thank you for having me.
So it's EMS week, and it certainly has extra special meaning this year. Normally there'd be a lot of events. How are you recognizing those heroes with COVID?
You know, this week with EMS week being as such a special week for us, because not only do we get to recognize our first responders each and every day, this week we tend to do things a little more formally. And typically every other year we've done larger events, larger recognition events, banquets, things like that. But combined with our system leaders getting behind EMS as much as they have and continue to prior to this crisis and ongoing throughout, and then combine that with an excellent marketing team that we have that's been able to do a lot of public-facing recognition. Our EMS coordinators and medical directors throughout our system, who have been just phenomenal throughout this, are going out individually, recognizing our frontline providers. And then we're also able to do a lot of our recognition virtually as well, and then also through a lot of our digital campaigns.
Now, what safety measures are in place for the EMS community? I know there's been a lot of concern about them.
We have, and obviously our provider safety, whether you are in the hospital working as a clinician or provider, or if you are in the pre-hospital environment, our safety of those providers is our forefront priority. So what we've done is we have looked and we've worked hand in hand with our State Department of Public Health Office of EMS and made sure that the protocols that we have don't compromise the level and quality of care that we need to provide our patients each and every day. But then also we take a look at ways that we can better isolate ourselves in terms of those little high-risk techniques and procedures. So for example, up at the Wyndham Hospital, our paramedic team up there have implemented different types of isolation precautions, so we can still provide that same quality intubation skills that we can provide, that will truly be a key differential in life-saving techniques, but then do so with reducing the exposure risk, and that's just in the pre-hospital environment.
Right, and just quickly before I have to let you go, people are concerned about going to the hospital, concerned about calling 911. What's your brief word on why they shouldn't be?
Absolutely, there is definitely never a need to delay care, right? Because that is when we're at our greatest risk. It is, if you need to call 911, do so. Our crews, our teams, our hospitals are prepared for these types of incidents, and we have properly protected not only our patients that are COVID positive or under investigation of, but then also to make sure that when you arrive and you are not COVID positive or have any symptoms related, you are still provided a safe area for not only transport to the hospital, but then also while you're at the hospital. So please, please, please do not ever delay calling 911 when the time is of the essence.
Thank you so much for your time. We appreciate it.
Thank you. Have a great day.
Stay safe.